We're going to be demonstrating borderline personality disorder using psychoanalysis as therapy, and Zia is the psychiatrist and Zoe will be our patient. Borderline personality disorder is a personality disorder described as a prolonged disturbance of personality function. This results in an instability of mood and unstable interpersonal relationships, self-image, identity, and behavior. Psychoanalysis is a type of therapy where the patient freely associates their thoughts.
Good afternoon, Zoe. Hey, Dr. Oliver. How have you been? Good. So, what's new with you? It's fine. You're going to invite me to sit down first. Have a seat. So, what's been on your mind for the past couple of days?
Nothing much.
Anything new with the family?
Well, my husband and I were talking this weekend, and he was saying how he has a business trip, and he's leaving for it tomorrow.
Okay. How does that make you feel about it? Are you happy that he's going away?
No, of course not. Who knows what he's going to be doing over there?
Well, what do you think he'll be doing over there?
Probably cheating on me or going with his other wife.
He has another wife?
Probably. He's always away on business trips in Chicago.
How many times has this happened before?
Like 4 times.
4 times? And he's always come back, no?
Yeah, he has, but that doesn't mean that he doesn't have a wife over there and children.
So, what makes you very suspicious about his acts?
Well, every time he comes home, he smells of something different. And every time he's home, I see a little red smudge on his collar. It looks like lipstick. I don't know. It's just a different color every time, and he smells differently. It's so annoying.
And it couldn't be pen or something? Maybe he just got something on his shirt?
No, have you never seen lipstick on a collar? It looks exactly like lipstick. And every time he comes home, I see this smudge on his collar. It's a different place every time he comes home.
And these aren't just old marks from you?
I mean, it could be for me, but still. And I know we've talked about this in other sessions, but what's to say this time is it different? And I know it goes for only 2 days max, but still, things can change.
Well, if nothing happened on the other trips, why is this trip different?
Well, things change. And I don't know, he could have just, like this time he has a new assistant. I know she's 30 years older than her, but still, come on, he's there late hours every single day. He goes away on these business trips with this lady. Age doesn't matter nowadays.
But he probably stays late to, make a better income, right, and help you with all your finances?
I guess that could be one way to look at it, but I know he loves us all, but it's just hard because every time he's out so late, I never know what he's actually doing. I'm always suspicious of this lady. I'm always suspicious of what he's doing when he's on these business trips. I just never know what the real side of the story.
Well, you married him, so you must trust him, right?
I guess so.
So if you trust him, it won't be that big of an issue, correct?
Yeah.
So now what makes you paranoid that he's going to cheat on you while he's away?
Because I can't see what he's doing. So if he has the freedom to do what he wants without me looking at him the entire time, then what's to say that he's not going to cheat on me?
Oh, does he usually call you when he's away on business?
Yeah.
So if he calls you, he obviously can't be, with other women, right?
You could just tell him to be quiet.
Well, that's one way of looking at it, but if you trust him enough, you know that he wouldn't be with anyone else.
That is true. I did marry him. So I guess I do trust him on some level.
Right, so does this make you feel more comfortable with him going away this weekend?
Yeah.
Okay, so we will meet again on Thursday, and you have my office number if you need to talk.
Thank you for your time.
Of course.
This represents a person with borderline personality disorder and shows their fear of abandonment and anxiety over relationships.